Great. So thanks so much to all of the presenters. Those were great presentations. And before we jump into the panel discussion, we're going to take just a moment to hear from representatives of the donor partners that are providing the funding for the studies that we've been learning about. So first, I'll turn it over to Paul Bolton, who is USAID's MHPSS advisor. Thanks, Paul. Paul, I think you need to unmute.
I think after all this time, I would remember to do that.
There you go. You got it.
Right. Thanks, Ev. And thanks for you and everyone for inviting me today. So I am the Mental Health and Psychosocial Support Coordinator for USAID, and it's a new position. I've only been in it for 1 year. I regard it as good news because it represents for the agency a commitment to working strategically to introduce more and more appropriate and evidence-based mental health and psychosocial support into the agency programming. And we have two approaches. One is within the agency and our implementing partners in the wider world, we're trying to increase the appreciation of mental health for its own sake, right? It would be better if people just had good mental health just because it's a good in itself. But there's also the other part that mental health and good mental health is a critical part of our other programs. We know from the literature that there's strong connections between mental health and, for example, HIV, TB, early childhood development, youth physical and mental health, maternal health, education, nutrition, climate change, and I could go on and on. So mental health is increasingly understood within the agency, including by our new administrator, as being a critical part of programming. But we're held back by the lack of information on how to implement programming in order to be effective. I mean, there's data out there, but there's large gaps in it, as has been mentioned previously. And so I see the HERD project as really being critical to this, to addressing at least some of the major deficits that we have in our knowledge. For the HERD project, I mean, part of it is the importance of doing individual studies, but equally and perhaps more important is the MHPSS Learning Collaborative, where you are comparing studies across sites. The importance and the power of knowing what the commonalities are across sites and across different issues and what varies between different sites is going to be absolutely critical to designing our programming. So I'm really confident that this whole initiative is going to be an important influence and informant on USAID programming going forward. And I want to thank you again for inviting me for the webinar today. It's already been fascinating. Thanks.
Thanks, Paul. And now over to our GIZ representative, Elena Mao. Thanks for joining. Elena is the MHPSS Lebanon project lead. Please go ahead, Elena.
Thank you. Thanks for having me. I love those presentations. I will be super brief. I think what we have seen in the last 2 years is how projects can really win through this margin of flexibility and room for adaptation that donors were giving to projects given the exceptional circumstances of COVID. We are supporting Watchchild on behalf of the German Ministry for Economic Cooperation. What we learned in those last, or what we experienced in those last 1 or 2 years, was that we were given much more flexibility in implementation and in adapting projects to the current circumstances. And what I've seen today in those presentations, and what I've also learned from cooperating with Felicity, is how much research and projects can bring if we give room for flexibility. I mean, all those fascinating, found it extremely impressive. And I think this learning cooperative and so study, or like this joint, let's say, study setup is so important because you make such a strong case for the necessity to provide room for flexibility and for adapting, because also in the next years, of course, we will be continuously in a situation where we will have to adapt and where we have to deal with complexity. So this cooperative or this collaborative, only the fact that you show so impressively how important it is to adapt and to come up with new ideas to changing circumstances. It's already a great win. So thanks for having me, and I'm looking forward to the panel discussion.
Thanks, Elena. And now we will jump into the panel discussion. Over to you, Vicki and Paul.
Thank you. Thanks to all the speakers for a wonderful discussion about your process for adaptation and all the great insights and strategies you guys shared. I want to start out with a very general question around what was the most common underlying reason for psychosocial burden that you guys found related to COVID that came from the audience. And so I thought maybe each team can just talk really briefly about that. Feel free to jump in.
Hi, everyone. My name is Carolina. I would say that Frontlines had already a lot on their plate before the pandemic, but now it definitely became more challenging. I would like to answer these questions from two sides. First, what the organization is doing, and in that sense, we have a global strategy, but as well, it's very important the local strategies that each site has. So this has become a key component. But since we have short time, I would like to as well highlight the importance of how frontline workers can also take action to cope with the stress. And this is important because it goes to day-by-day actions and how they nurture or the exposure they allow to media coverage and so on became really important. And that's because it goes to more centered in prevention more than a reactive approach. And I think that becomes key under these circumstances. And with that said, I will take time to just thank all of our team that actually became very flexible during this time on behalf of the Panama, Ecuador, and headquartered team. We're very happy to represent them as well here. So thank you.
Thank you, Carolina.
Hello, everyone. First of all, I'm Juan Fernando Botero, as Victoria mentioned, from Heartland Alliance International. And first of all, I want to thank everybody at the team in Colombia who has been crucial for the implementation of the project. And that includes the CPS and the professionals, specialists, and everybody, and the country director as well. In regards of your question, Victoria, I think a key element was the supervisions, and they were key for all the staff to learn how to implement under remote modality and the hybrid modality that we were using, and because it was challenging for them in terms of that, although as Leah mentioned in their presentation, high use remote sessions for individual interventions, the group sessions were completely new to everybody, and how to implement those in this under lockdown or COVID conditions was challenging for everybody. And the supervision sessions with the supervision team were incredibly important for everybody, just to first of all learn how to provide the services, and then be more easy or find ways that didn't feel so instructive or less difficult for the participants to engage in the group sessions. Thank you.
Thank you, Juan.
Maybe I can also just answer in terms of what in Jordan, what we were finding were the common sources of psychosocial distress amongst participants, that were exacerbated by COVID. I think mainly two main things were frequently highlighted. One being the worsened financial situation with COVID, with loss of livelihoods, and so on, as well as really the loss of support outside of the home. We're thinking of the family as a family system, but in the systemic approach, we're also thinking about, how that system connects to outside systems. And yeah, there was a lot of mention of distress around social connectedness with informal support, as well as lack of accessible services for like more formal services as well. So I think those were the two main things that were highlighted in our study. And it really did speak to what other speakers were saying before about the bidirectional relationships between mental health and well-being and other outcomes, whether it's economic or health or other outcomes.
Thank you, Felicity. Claire, did you have anything else to add, or should I move on to the next question?
Sure. I mean, if there's time, I will just add a little bit to what Carolina was saying, who really nicely highlighted some of the COVID-related factors that were challenging and stressful from the provider and frontliner side. When we were doing our initial formative research, those data were collected alongside kind of the height of the lockdown period. And so I think a lot of the information we got really reflected some of the direct COVID-related stressors, but also some of the indirect impacts of COVID, which were quite similar to what Felicity shared. And I just quickly pulled 3 really short quotes from some of our qualitative interviews that I wanted to share that describe this. So in the early stages of our work, one woman said that we fear that we will catch coronavirus. The women become stressed thinking about what will happen if they die, and they are thinking about their children who will take care of them. And another woman talking about some of the kind of social consequences of COVID talked about the fact that due to this pandemic, there's a lot of stress and the neighbors do not want to or don't feel comfortable helping. Everyone is worried. And then the final quote I wanted to share really highlights, I think, the economic consequences of COVID for these community members, where one woman said, the difference with the pandemic is that you cannot move. There's not much work. Before the pandemic, at least you could clean houses, but now people don't want to bring strangers into their homes. So I think these just really highlight both the direct kind of COVID-related stressors, but also some of the indirect impacts of COVID in migrant communities. Thanks, Vicki.
Thank you. We have one other question, and then I'll pass it all to Dr. Bolton. The HAI team, you guys had a really great discussion about the 3 different methodologies, in terms of delivering services. And we were also wondering about, what are the factors that made the remote delivery most effective? What were the main considerations, given that at times we're going to need to do remote delivery? And you also mentioned that it was very difficult to transfer the peer support and benefits. And so what are some strategies that you used or, that you think would be useful for doing that?
Thank you, Victoria. I think one of the key elements or the things that we tried was, first of all, to provide, as Leah mentioned, mobile phones and data for the participants, and that encouraged them to participate in the sessions. There were also things like, as Claire mentioned in her quotes, issues regarding people don't feel safe of being out and being afraid of the contagion of COVID during the in-person sessions. Even though HAI has a very sort of a strong policy to implement services during COVID. So we created that just to prevent and to participants to feel safe during the interventions in person. And there were also, as Leah mentioned, issues related with the conflict that exacerbated during the COVID pandemic in Colombia, and also the protests that sort of engulfed the country throughout, not only in Quibdó, for about 2 months. So the remote intervention was critical for us to be able to deliver and to safeguard people from any harm during this difficult period. I don't know, Michelle, if you want to add something.
Yes. Thank you, Juan Fernando, and thank you all. Something that I think has been critical, and I has think about this from the beginning, is the security issues that Lee explained on the presentation regarding the privacy, confidentiality, and all this. So I think in advance of this and design a security protocol within the houses, for the participants, to inform the ACPs during the intervention when they had the confidentiality ensured by using safe words. For example, when some of them lived with a perpetrator of violence within the family. So building this security protocol has been really critical to ensure that the participant had the safety conditions. Another thing that we think that is very important was to face the literacy of the participants managing platforms. So I deliver assistance in trainings for the participants and also for the staff to ensure that these activities could be provided in a good manner, we can say, and also following up the participants between sessions in regards to these disconnections that could be suspicious, for example, in really emotive moments of the sessions that they reported that could be related to these disconnections, not to the connectivity technological issues, but more for the topics that were discussed in the sessions. And they found that doing these follow-up calls really was an engaging factor for promoting the participation and also ensuring the security of the participants. So, yes.
Thank you, Michelle. I'll hand it over to Paul now to ask one last question.
Thanks, Vicky. So you've done doing different projects, and you're at different phases in the different projects. So I'm really curious if you could each briefly, for each project, just say one thing that you think that I, as a funder or other implementers, really should know, something that you have found out so far that really stands out, and of course something that you haven't already mentioned. So you have our ears now. So what do we need to know?
I'll jump in first, and Paul, I think you'd probably agree with this maybe, but I think one of the things that we repeatedly find, I mean, first, obviously the need for flexibility. We had to shift course dramatically, which we mentioned during the presentation, but I think also flexibility in thinking kind of multi-sectorally. We kind of repeatedly hear the importance of thinking about economic opportunities and other types of services, protection services that are so closely linked to mental health. But often I think funding and really organizations are more siloed than that. And so trying to think more flexibly about what we include under these strategies to support mental health and psychosocial well-being is something that I've learned.
Thank you.
I would just like...
Sorry.
Okay. No, just to complement what Claire said, I totally agree. We do see, and I think that we're in a great spot right now because, and I should thank URC for this opportunity that we're just on time sharing and learning. And this becomes crucial because we're kind of translating knowledge into impact, and that's what we aim to do. And for that, we have become very flexible, but we know that, and as Claire says, we need to address another kind of issues as well, like economic inclusion, because they cannot have mental tranquility when they are thinking what they don't have something to provide to their family. So that's something that we have thought a lot, and we have talked a lot about sustainability and how simplifying the methodologies means that they can stay in the communities. And that's what we look for. And not to go to institutions or so on, but to create opportunities into the communities. And for that, I think that we need to simplify the way that we do things and to listen a lot about the community and to our own team that is on the field. So yeah, just to compliment. Thank you.
Thank you.
I was going to add a related point that has to be in terms of the process of handing over the projects to the system in general, and the feasibility of doing so. Something that the participants had remarked in the pilot and also in the RCT is the frustration about the project finishing the activities and that the groups finish. No, so something that has to be done is to think how to engage with the system in order that these programs continue as in a regular basis. How is this feasible? How is the will of the system in articulating and taking over these interventions? Otherwise, we could be creating false expectancies after we go. So, yeah, this is a crucial process, I think.
Yeah, and continually on our minds. But thanks for emphasizing it. But it's, yes, big issue. Anyone else?
Yes. And before Felicity, I'm sorry to jump in. I think there are like one sort of following up on what Michelle was saying about trying to figure out ways that participants can adopt and appropriate these processes by their own and sort of moving it forward in their community is a key element. And we find during the project that trying to adapt and include cultural elements within the protocol was important for this sense of relationship with the good protocol and with the rest of the participants within the group. So these cultural elements helped sort of relax the sessions and make participants think about how and when they can use the different tools that we provided to them. And we were in a discussion with Michelle about how to make the language of the protocol more related to the communities. And one of the key or major objectives of the whole community-based protocol is to build those networks within the community, to make it reconstruct what they have lost in terms of community. And for these cultural elements are sort of paramount. They should be there and they can help mediate all these technical elements that we are sort of given to them to what they have learned and they use and they know works in their community and sort of make that translation and being able to communicate sort of the technical part with a more practical elements.
Yeah. To some of the presentations, for example, yours, Claire, where the idea was that that process should continue throughout the project, right? So it's not something where you do these huge local adaptation efforts in the beginning and then you stop. Even in trials, adaptation, I mean, the basic program should stay the same, but the adaptations should continue. You should be always trying to make it better, more appropriate, more acceptable. So thank you. Great. Thanks very much for that. That was worth the price of admission. I'll give it back to you, Vicky.
Thank you, everybody. Thank you for joining us. We didn't have enough time for all of the wonderful questions that came in, but we will be answering all of the questions and we will share them at the, maybe in a few days once we put together the recording of the webinar. The transcripts will go out to everybody who registered. So thank you. And now I'm going to turn it over to Rosemary Mosaka from EPSA HC, who's going to close out for us.
Thank you very much, Vicky, and thank you to all the presenters and panelists. On behalf of EPSA Health community, we appreciate for this opportunity to be part of this consortium. And we are happy for the first series of webinars, being the first one on mental health and psychosocial support. And we are looking forward to learn a lot through the great work which is implemented through this collaboration. So this is just the beginning, and as the focus for this project is to inform our policy and programming. So we are also happy to say that we will take this evidence and the lesson just from this first session and the coming ones just to inform our programming and policy. And we know how critical the aspect of mental health and psychosocial support is, specifically in response as a critical part in response, as well as preparedness to emergencies like COVID-19 and any other health emergencies. So as I've said, this is the first session, and we're gonna have a number of webinar series on mental health and psychosocial support. And I would like to share with you that the next series will focus on reaching policymakers in mental health and psychosocial support, evidence translation, and service integration. So this will be held sometimes in January 2022, if all goes well. We'll share all the information in due course. So I would like to take this opportunity on behalf of all the partners to thank you, all the participants and everyone for your active participation. Feel free to drop your questions and we'll be happy to respond. Thank you so much and have a great day. Thank you.
Thank you, everyone.